Hi, everybody. It's Professor Miller. I hope everybody's having a great week so far. I tend to add a recording covering each module, an introduction to it, and just providing a general overview. So, our first module, we take a look at basic introduction to health policy for advanced practice nursing. The course module runs from September 11th, which is today, to the 24th. At the top of every module, I will have topics, readings, and assignments, which also has the dates in there. And I also have the discussion forum, um, the dates or due dates essentially within that as well. You can also find the course readings with the textbook readings that are for the course module. In terms of some of the documents that I had posted on here, I always like to go through these just so you have an idea of what to kind of think about with each area essentially. So at the beginning, I did add the Institute of Medicine, the Future of Nursing document. It's a very, very large document, but you will definitely hear about this document, the Future of Nursing, within your textbook. You'll find it in other advanced practice nursing journal articles, a lot of systems leadership articles, and I believe even one of these even discusses it as well. I highlighted a couple key messages on page 21. So you can just briefly browse through that. Obviously, it's a very large document. You don't have to read the entire thing, but I just thought I would add that. So at the beginning of our module, we're going to take a look at the introduction to the U.S. healthcare system and how APNs essentially are integrated within our system, or how we would like to integrate them more within our system. When you have a chance, just briefly look through that PowerPoint that says Health of the Healthcare System. You'll be rather surprised when you look at the outcomes of patient health in terms of how much we spend, in terms of the U.S. in comparison to other developed countries. Our health, unfortunately, the U.S. population is not equivalent to the amount that we spend on healthcare, essentially. So take a look at that when you have a moment. How nurse leaders can fix our healthcare system. It's just a great article. It does talk about the Institute of Medicine and the current recommendations. So that's a good one to kind of, briefly browse. It'll give you a good idea of how we should be integrating APNs, on a more broad level. Advanced Practice Nursing Shaping Health Through Policy is a great article. I suggest that everybody read this one. It's not too long, but it kind of gives you a good idea of what we should be doing in terms of health policy. APR integration, improving care. A lot of this is more related to primary care. So those, NPs that are going into, an adult GERO program, or you're in the family nurse practitioner program. It looks at different realms of practice and how we can improve care, whether it's through like telehealth, retail clinics, just looking at different methods to improve the health of the U.S. I did add 2 documents for forensics. And back, you'll read a little bit about this too, about the Affordable Care Act. Obviously, that was implemented a while ago, but they were trying to disband portions of it. But there was a lot of great changes that were implemented with it, and a lot of it focuses on prevention, which is a huge area that obviously we need to be going to instead of treatment of acute illness. It's more about prevention. So there's some good. I just added 2 different documents from the Family Violence Prevention Fund. And you can look at that. It's the Futures Against Violence. And there are 2 different documents that discuss changes that were basically implemented with the ACA. All preventative care services, whether it's screening mechanism like mammograms, all that should be covered during under the ACA now. So there's current recommendations about integrating domestic violence screening, childhood trauma screening. So there's a lot of areas that you can kind of think about and how it applies to forensics. And that's the other thing I always mention too with this first module. Even if you read, for our forensics nurses, even if you're reading an article that may be specifically written to a nurse practitioner or a CRNA or a midwife, honestly, your role as a forensic nurse is pretty much very, very similar as a role of an NP or a CRNA. You just got to put it in perspective of your practice or your specialty area. So when we talk about, prevention and screening, really try to think of it in the realm of your own practice. So, even if it says, NPs or CRNAs, really try to think of it as really how does it pertain to your area of practice as well. So it's always good to think that way because you guys are like the up and coming, advanced practice forensic nurses, and you will be developing these guidelines and you will be developing preventative methods or policy essentially. So it's really important to kind of take a look at that from that perspective as well. I also have, these are just general introduction to the legislative process, and you may already know a lot of this, but I did add the Citizens Guide to State Government, and I just updated it because I had an older one up there, but essentially it's for Michigan too. It looks at like the different houses, different committees, and essentially how the state legislator works essentially. So obviously it's a long document. If you want to look at it, you can, browse through it. But it does tell you, a little bit about committees and who you would be essentially guiding or looking to if you wanted to implement policies or advocate for a policy. How a bill becomes a law, they also talk about in that other guide. But it's a brief document you can breeze through essentially. Basics of reading a bill, same type of thing. I just added that. I added these two little books. When you click on it, there's a video in each one, and one of them is from the American Academy of Nurse Practitioners, and one of them is about communicating with policymakers and proposing a policy and how you should approach them, and it just gives you a good foundation. In terms of how you should communicate with them. The other one, too, is on the legislative process, which you might already have a good understanding of, but I thought I would add it. We'll briefly look at populations and health disparities, so I really want you to think about that, too. When we look at healthcare transformation, we have to think about all these other areas and how we have health disparities. There's a lot of difficulty with including social determinants of health in the care that we provide. So even when in the outpatient setting, it's an area that is not integrated well within our care that we provide as practitioners. Because obviously when you think about it from the perspective of not having transportation, not having medical coverage or access to healthy foods, it makes a huge impact on patient health or population health. So really there's a great article, it's on disparities in care. It just gets you thinking about areas that we really need to be including or, developing policies or even screening mechanisms that we should be looking at with our patients. And there has been a lot of discussion recently on technological advances, like even when we talk about EMR. We should be screening for this stuff in our EMR and collecting data on it and making sure that we're actually addressing it. Anyways, briefly take a look at that. The other thing, too, is the coverage gap for uninsured adults. This one's a tad bit older, but it still pertains. Basically, with the ACA, there was a proposed policy change that basically kind of left it at the determination at the state level. So Medicaid expansion was encouraged, federally at the state level, but that's up to the state to basically make that change or implement that. So some states did not, unfortunately, expand Medicaid. So there's a huge gap of patients that unfortunately are uninsured because they don't, necessarily, or they can't afford, health care through the ACA. And they're kind of not meeting that poverty level line. So then we have this huge, gap of uninsured adults. Obviously, that's another issue, too, when you look at population health. Because in one of the discussion questions, and you can look at this from two different perspectives, one being, how does it affect our populations with issues like this at the state level versus the federal level? Or you can take the realm of practice as a NP or even forensics. How does, scope of practice issues, which we'll talk about a little bit more further in the next module, how does it at the state level impede upon what's recommended federally? But you can kind of go either way. That's how I like to keep those forums too. Like if you feel like you want to discuss a certain topic, I'm more than, happy to let you do so. So, I kind of let you guys take the path of what area you want to talk about. This is just examples of state and federal policy, because obviously it moves through different sections of the legislature. Like it'll move through the Senate, the House, and sometimes as it moves through, there's changes. It may change, or it may not even make it past the House. They kind of get stalled, and that's the end of it. Or it may not make it out of a committee. So I just added, two examples on under that area. I did add this for forensics, and this actually might be a good area to kind of think about for like policy topics. These are just federal initiatives that were supported, in the area of forensic science. So you may want to look at that. It just gives you some good topic ideas or things to think about. General resources. This is indicated for, or it was basically drawn or it was a publication, excuse me, for patients or the older adult. But as a practitioner that's providing care for an older adult, it's a good resource to have on hand, if you ever need to find out information for your patients. So like even those adult GERO NP students, it might be a good thing to kind of look at. State Legislators Guide is very similar to the Citizens Guide. It's just more about the policy process. So if you need to figure out information there, you can just briefly take a look at it. Course activities, obviously our discussion forum is in here. So our first forum, I have it set up as a Q&A forum, so you have to post your response and then you can read everybody else's. But just have your first your first discussion response posted by the 18th at midnight, and then you have 5 days thereafter to do a follow-up response. And you don't have to do 2 responses for each peer. It's for each question, it's 2 responses total, if that makes sense. So when you're doing this, just post it in each form that coordinates with it. Like I just have 3 of them because there's basically 3 questions. So in your opinion, what are some of the key forces driving health policy and the overall transformation of the U.S. healthcare system? So like I said, you can, focus on a certain area that you feel is really important. I kind of let you take your lead on this. What are the main goals of healthcare transformation, and how does advanced practice nursing align with this, or how does it supplement this essentially? Barriers at the state level can at times impede upon the success of federal health policy initiatives. Based on your readings, what are some state level barriers that can affect the overarching goals of U.S. healthcare transformation? And it's kind of what I mentioned a few moments ago. In order to effectively engage in state and federal health policy issues, you need to be aware of your elected officials, identify and list the state senator for your district, your representative, and then your U.S. representative for the state. You don't have to make a huge paper on this, literally list them, but what I want you to look at is their background. Do they have any background in healthcare? Do they have any background in health policy issues? Are they part of like a House committee on healthcare? So really, I want you to think about this, because if they don't, obviously it makes it more imperative for us to be educating them on healthcare issues. So I just want you to take a look at that and figure out who your representatives are for your district. You can go to the Michigan Nurses Association, and they do have if you go to the advocacy tab, they'll have a link that will take you to this information essentially. But like I said, for this one, don't feel like you have to write a paper. It's literally, I want you to figure out who they are and look at their background. And obviously just write a little bit about, how do you feel about, or what do you think about their background in terms of healthcare. So that's it for Module 1. But like I said, a lot of these are more, these are like supplemental PDF files essentially. These are more to kind of get you thinking. So don't feel like you overwhelmed by the stuff that I post. A lot of it, like I said, is really to kind of get you thinking about different areas and just to stimulate discussion on different topics. So if you have any further questions, obviously, please feel free to reach out to me. You can email my regular OU account or, through the internal email as well. I do check it pretty frequent. So I will talk to you guys soon, and I hope you guys have a great day. Thanks.